Let's talk about how we're going to treat our chest pain patients, or maybe how your chest pain patients are being treated at home, what medications they might be on, including some nitrates. Your patient might be on a nitrate at home and may have taken a nitrate before you even got there. So your patient called 911 for chest pain. Their doctor told them to take this prescribed medication. It's a nitrate, and before you even get there, they've taken one or two or three doses, or we're going to give them some nitrates. So how do nitrates work? Mechanism of action. Well, our nitrate medications first converted to nitric oxide in the body. Nitric oxide is a pretty potent muscle relaxer. It's vascular smooth muscle. So it relaxes vascular smooth muscle, vasodilates. It's going to decrease venous return. It's going to decrease preload coming back into the heart, into the right side of the heart. So what are we going to see? Well, in our vital signs, we're going to see blood pressure drop. That's a normal thing. We don't want it to drop too much, so keep an eye on it. We're going to check blood pressure. We're going to check vital signs before and after giving any medication, right? But really important here to keep an eye on blood pressure with our nitrates because of that vascular smooth muscle relaxation. It's going to vasodilate and it's going to relax all this vasculature. But the end goal is that our myocardial, our cardiac cells, the oxygen demand in there is reduced, which is a good thing in this case. Chest pain, supply is not meeting demand. So if we can lower demand, maybe we can lower it to the point where supply meets our demand. Most common nitrate that you're going to see patients prescribed and that we're going to give on the truck is nitroglycerin. So using this in chest pain patients, suspected MIs. We think they might be having a heart attack, or maybe they just have, um, stable or unstable angina. We're gonna treat this chest pain with nitroglycerin. They might be prescribed this as well, so they might have a cardiac history. Their cardiologist has given them nitroglycerin, and the cardiologist says, "Hey, when you have chest pain, take one of these little pills and see if it works. If your chest pain goes away, don't worry about it." So you're out there, you're mowing the lawn, you start having some chest pain, go inside, sit down, take one of these. But if it doesn't go away, call 911. So, with patients with cardiac history prescribed nitroglycerin, they have probably taken one before you've gotten there. Um, and what their physician usually tells them, the prescribing recommendations are take it every 5 minutes. And take three of them. So take three every 5 minutes until your chest pain goes away. And we are going to do the same thing. We're still going to give them three of our own, even if your patient has taken three. Because what if your patient's nitroglycerin isn't the freshest, right? Maybe it's from like 1993. Well, that nitro is not good anymore. So, don't quite know. Don't know how they've been storing it. We know that our medication is good. We're going to do the same thing, up to three every 5 minutes until the symptoms are relieved, until chest pain goes away. Again, paying attention to that blood pressure, right? Nitroglycerin, or just nitro, comes in a lot of different concoctions. We can give it a lot of different ways. Most commonly is in a tablet form, sublingual, goes under your tongue, kicks in pretty quickly, lasts 15 to 30 minutes, give or take. But one sublingual tablet is about zero point 0.4 milligrams. Same thing with the spray. So you might see a sublingual spray. Just spray it right under the tongue. Same place you'd give the tablet. It's just a little spray. Same onset of action, same duration of action. The dose is about the same. It's not quite as controlled as a tablet dose wise. I mean, one spray is different from another spray, is different from the third spray out of that little bottle. But quickly absorbed, easy to give. We can also give paste. Skipping over the intravenous for a moment, but we can give that paste, give that ointment. So same onset of action pretty quickly. Duration of action lasts a long time. So we're going to set up this paste. We're going to put it on them, typically upper chest or upper outside of the arm is where we put that. And we are going to dose this. So 1 to 2 inches. We can give 1 inch, we can give 1.5 inches, we can give 2 inches. This is going to be dependent on systolic blood pressure. So you take your patient's blood pressure, it is 180 over 100. I'm going to give 1.5 inches of nitro paste. I'm going to put that on my patient's upper chest. So I measure out on the special little measuring paper. I'm going to measure out 1.5 inches of nitro paste, tape it down, put it on my patient's upper chest so I can see it. So we want it on the upper chest, upper arm, so it absorbs into kind of a larger, kind of muscular, vascular area, and also so we can see it. And when we drop our patient off and nurse takes over, the nurse can see it and sees that it's there. Because every 6 hours it's going to have to be changed out if the patient is still having symptoms and they still want to continue the nitro regimen. So put it on there, tape it down, and put the time that you started that paste. So I put 1.5 inches on. I started it at 0900 hours. So my nurse, when I drop the patient off, hand over report, knows that in 6 hours, at was 6 hours plus 9, at 3 p.m. at 1500 hours, that nitro paste will have to be changed out, have to be kind of renewed. Put a new patch on, some new paste on, because it will lose its potency after about 6 hours. Great thing about paste, your patient's blood pressure starts dropping. Well, we can wipe that paste off. We can clean it off so it slowly absorbs into the body. And if we start seeing some adverse effects, some side effects of our nitro, we can just wipe it off, and no big deal. And then we have our intravenous. Typically, you'll see this in the hospital, in the ER, in the ICUs. You'll see this on critical care trucks. Some EMS agencies carry IV nitro. I love IV nitro. It is easy to handle, easy to maintenance, easy to start, easy to stop, easy to titrate. So give it IV, again, onset of action, really quick. Duration of action, as long as we're giving it, we're giving it. Right, it's going IV. Your dose starts at 5 micrograms per minute, and then we're going to titrate up based on symptoms. So I'm going to start at 5 micrograms per minute. Wait 5 or 10 minutes. My patient's still complaining of some chest pain. Right, and maybe I've given some pain medications on top of that, but they're still complaining of chest pain. I'm going to titrate it up to 10. So I'm going to titrate by 5. So 5 to 10 to 15 to 20 to 25 micrograms per minute. All the way up to 200 micrograms, which is a lot, right? So we can titrate this, and we can really kind of zero in on what's best for your patient's symptoms. All right, another nitrate, you'll see your patients being prescribed this. So you'll see your patients on this at home. We're not going to be giving this on the truck, but you'll see isosorbide, which is this prophylactic treatment of angina. So we're trying to stop angina before it starts. We're trying to stop the chest pain before it starts. Real slow onset when compared to nitro, a lot longer acting than is nitro. So your patients are on this every day. At home, they're not taking it when they feel chest pain, just like they would with nitro. So nitro, if you start feeling chest pain, take it. Isosorbide, take it every day, take it every morning. So get some isosorbides. Please don't commit all of this to memory, but isosorbide, a little bit longer acting, onset of action, a little longer than our nitro. So nitroglycerin for acute chest pain, and then isosorbide is for kind of chronic maintenance of angina and chest pain. Major side effects that we're going to see, one of those is headache when we give nitrates. Nitroglycerin in particular, your patient is probably going to complain of a headache, and that's fine. That's a side effect. We know that's a side effect. That is a common side effect. We know the medication is working when they get a headache. So don't freak out. They start complaining of a headache. Just walk them through the process, walk them through these side effects, explain that headache is a normal side effect of nitroglycerin, and that's how we know it's working, and that's why, maybe how we know it's helping them. Other side effects, hypotension, so we're going to pay attention to their blood pressure and keep an eye on their blood pressure. And then tied to that is dizziness. So if the blood pressure drops too much, If it drops too low, they might get dizzy. If it drops too fast, too much too fast. So I had that patient with a blood pressure of 180 over 100. I give them one nitro, and all of a sudden, the blood pressure is now like 110 over 70. They're gonna feel that, right? So blood pressure 110 over 70, and like that sounds good, but it just dropped from 180 over 100 to 110 over 70. It's a huge drop, so they're gonna feel that. So might feel a little dizzy if their blood pressure drops too low or if it drops too fast. So some contraindications depends on local protocol, but typically if your systolic blood pressure is less than 100, we're not going to give nitro. We're not going to give these nitrates. We're going to hold off because of that hypotensive effect. And then, if your patient has taken any erectile dysfunction drugs, depends on the medication. So 24 to 48 hours within the time you see them, if they've taken any erectile dysfunction drugs, that's a contraindication for nitro, for isosorbide, for any of these nitrates, because our common ED drugs are nitrates in and of themselves. So we would be essentially double dosing them on nitrates, except they've taken this long acting, long lasting nitrate, and we are dosing them up acutely with nitrates. So we're going to see some pretty, if this happens, we're going to see some pretty big drops in blood pressure. So common side effects, and there are a couple of contraindications for you.